Good morning. So I want to talk about the Unit 2 material and some of the contextual factors that were discussed in this unit, and just talk about how my experience in the past, both through field work and as my experience I was a Navy corpsman, which is a medic for about 6 years, and then after grad school, the first time, worked as a pharmaceutical rep before I went back to OT school. So through those experiences, I've had quite a bit of exposure to some of these factors, and they've definitely played out differently in the military versus the civilian workforce. So starting off, all these factors, what I saw is they're very interwoven. None of these are in silos. You start talking about politics and legislation. Politics, we're still gaining notoriety as a profession and trying to really establish our worth. And I think for us as OTs, what we have to do is really advocate for ourselves and for the profession. And I think that starts with our clinical practice and being able to show other professionals, our clients, and other key stakeholders what the benefits of OT is, and what we can do for our clients. So I think that that will work its way up to politics when more and more people start advocating for our profession and have seen the benefits of what we can do. And so those politics or politicians really help to shape the healthcare policy through legislations, and then those trickle down and regulations enforce those legislations. So I definitely have seen the trend of people following the CMS recommendations. That seems to be like they set the standard for how those different policies are enforced and what those look like. There's when those come out, there's a lot of seems like there's a lot of ambiguity. It says these legislation come out that say that we have to operate in a certain way, but there's still a lot of lack of clarity, for better terms. So it's definitely seen how we follow the CMS recommendations, and so I thought it was really interesting. In the text, they're talking about the framework of managing, steering, and creating to manage the present, steer to the next horizon, and then creating the future. And I feel like that's a lot of times what we do. Things change so rapidly that you kind of have to manage in the present time, but have that vision for where you want to go. And I think that's where we are as a profession. The structure, the context of structure, I definitely saw a difference in the military versus the civilian world. So it's very complex. We don't have the whole single payer system like when I've been to other places in the world, that other countries that have the single payer, and well, I think there's a lot of merit to that system. We kind of have to operate within our wheelhouse and by the way things are. So I think that the military things were very, very simple. Everybody fell under the same the same insurance when you're treating active duty military. So I didn't have to deal with that all the nuances of being so many complexities. But I definitely am seeing that as I get out and experience more arenas. So I think that the whole aspect of community health is a real big opportunity for us as occupational therapists. We're really good about providing knowledge and education, and we can also help with consulting, to help decrease occupational barriers within the community, as well in the workplaces. I've heard of OTs that are doing consulting for workplace injuries and trying to reduce risk factors for things like that. And so I think that we have a really big part to play in the general health of our communities. Sorry, I'm kind of referring to my notes here. So for resources, funding, and reimbursement, obviously insurance drives what we do. I noticed this, it definitely affects the delivery. My last rotation was at an inpatient rehab facility. And so, there was a length of stay that pretty much was the standard. So we try to get people out of there, and that was really driven by Medicare in a lot of ways. But it's based on that whole diagnostic related group, the DRGs, and definitely saw how we did that in inpatient, and when we felt like somebody needed more services, trying to find those I won't say loopholes, but trying to help advocate for the patient and spill out to the insurance, like all the things that this patient might have going on that really create the need for him or her to be in inpatient rehab longer than like an average length of stay. And it was really unfortunate when we started talking about like the different kinds of payers. We had some people that like one patient who was just the self-pay, and the family was paying for inpatient rehab out of pocket, and they said that they could afford a week, and so it was one of those like kind of an ethical dilemma, because we know based on this person's condition that a lot of progress probably wasn't going to be made in a week. So that was really challenging, and I definitely saw that a lot as a pharmaceutical sales rep. I worked in some pretty disadvantaged communities, and it was just unfortunate that the insurance that a lot of people had just didn't allow them to have the medications that I was promoting. And it was unfortunate because I knew based on the research that those medications were were really good for the conditions that they were to treat, and so they were hands down better than especially from an occupational standpoint. I worked in overactive bladder and bladder cancer, and so when you start talking about your older patients and having to take medications that are drying their mouths out, and just some of the other side effects that really like put them at a greater risk of hurting themselves. So it's unfortunate to see and especially when we start talking about OT services, people that may have private insurance, may have went through the Affordable Care Act and purchased their plan, and they have like outrageous deductibles or coverage limitations that restrict how much they can see us. I'm doing my capstone on the pro bono clinic, and a lot of that is going to be seeing people who may have some form of insurance, but it may not cover, or they may not be able to afford to go see an occupational therapist. So that's a huge factor to consider, and that rolls right into socio-demographics. Understanding like the high risk, the high utilizers as an OT is going to be important, because we want to provide patient-centered care, and we have to consider where people are coming from, because that really impacts a lot of things like their health literacy. We start talking about providing primary prevention measures and getting out in the communities and helping people become more aware of different conditions that they're susceptible to, and taking actions to kind of mitigate those risks. But a lot of times, like we talk, or health professionals in general talk at a level above our clients' understanding. And so I think that we play a big part in making sure that we provide education, and we get out in communities and help to provide those those measures, those preventative measures, and provide them in a way that people understand. The whole socio-demographic thing is really big with what I'm doing in the pro bono clinic, and making sure that when people are coming in, we're giving them resources that they can understand, and we're really helping them work through that stuff, so that the information that we provide them can be translated into like a reasonable action plan for those patients. So lastly, looking at technology, and technology is just advancing. I just got a new cell phone, and I am struggling to learn how to use it. So technology is paced so fast, and with that, with the EMR advancements, we're getting a lot more data, and data is good because we're a evidence-based profession, and we really look at like the data. And so this data is going to start providing us with a lot of information as far as like our processes, our patients, what we're doing, is that actually helping them? So I definitely saw this, in my first clinic, or first rotation was at a neuro rehab, and so we did a lot of like client satisfaction and really trying to use some of those metrics to drive the procedures of how we operated. Same thing in the hospital. It was all data on length of stay and the conditions, and it was the data was what they looked at. Especially when you start talking at the rehab director role. When she sat in on our team weekly conferences, she always talked about the data and what the trends were doing and how we felt related to those trends. So I think that it's all of these things are going to impact me as a leader. We have to use this technology as OT to really prove our worth and prove that the results are measurable and we're making a difference. So I think that all these are very intricately related. It starts with the policies and legislation, and that trickles all the way down through. It affects people from socio-demographic backgrounds differently. Obviously the legislations are going to affect the pay or different types of payers. So there's just a lot. Like you can't make one change without affecting something else. And so start looking at the whole iron triangle and the cost, the quality, and the access. And so it's really going to be important to keep all of these factors in mind when I start thinking about being a leader in the OT world, and making sure that I look at all of them individually but collectively to see how they impact my clients and what we do. I think the one that I would like to learn more about would probably be the socio-demographics. I've always been really interested in where people come from and kind of that whole zip code breakdown, where why some communities are worse off health-wise than others. And from an OT perspective, I really want to get into providing community-based care and trying to get out into the communities and help to decrease some of those risk factors and just increase. I mean, the whole goal is to increase the public health. And so, while it's good job security to have clients that are coming in, it's a very good ethical practice to get out and try to help people before they have an issue. So that is what I'm looking forward to learning the most about. And I think that will really help me as I take on leadership roles. And I want to work with the veteran population. And a lot of times the socio-demographics play a role, especially when you start talking about older vets that may not have the resources due to a lot of times it's conditions from the military. So anyways, that is what I'm looking forward to learning the most about, and I think that all of these factors are going to help me to become a better leader. Thanks.